session for April 28th. So we'll go to action agenda item number 2.
Consider approving the Johnson County Development Support Reserve Use Plan, including the creation of 7.5 FTE, and consider authorizing the reallocation and expenditure of fund balance reserves for FY 2022 for the Developmental Supports Fund in an amount not to exceed $700,000 for the first year of the plan.
Mr. Von Onen.
Good morning, Mr. Chairman, Commissioners. Chad Von Onen, Executive Director with Developmental Supports. The item you have before you is an immediate action request for 7.5 positions to meet critical and urgent needs for people with intellectual and developmental disabilities. These positions will help the needs for people seeking case management, crisis behavioral health services, and competitive employment. I'll provide a brief description of the positions and then a temporary initial funding option for your consideration. First, the 1.5 case manager positions. Case management services are central to a person's navigation of services and supports. There is limited case management capacity in Johnson County, and as of today, there are actually 0 of the 17 case management providers accepting new referrals. Due to this and other case management provider closures, JCDS is looking to provide an internal solution, at least temporarily. As the CDDO for Johnson County, or the Community Developmental Disabilities Organization, we have an obligation to ensure this service is available. We continue to have efforts to bring in other case management providers to our local network, but there's been very limited interest at this time, and that has to do with billing limitations for the service and inadequate state reimbursement rates for the case management service. Currently, we have 14.5 case manager FTEs supporting 425 people. Adding these 1.5 FTE will provide services to approximately 45 additional people, which will include those on the statewide developmental disability waiting list, those moving into Johnson County, or those recently determined eligible for developmental disability services. And a case manager's responsibilities include things like driving the annual person-centered support plan. That's the plan that a person uses to determine what their needs are. They advocate on the person's behalf, and they connect the person to community resources. So if you think of a support team, that case manager is really the glue to a person's support team. Next, we have the 2 positions for the Community Behavioral Health Team. This team is a unique program in the state of Kansas. It's a partnership between Developmental Supports and the Johnson County Mental Health Center. The demand for this service has continued to rise. In 2021, 83 people were served through the Community Behavioral Health Team, and we now have a 28-person waiting list for this service. The team assists people that are in crisis situations, as well as helping their support teams develop plans to help the person stay in their home or in the community. To just kind of give an idea of the situations that these involve when people are in crisis situations, there's typically complex support needs for the person, and a lot of times many intense behavior challenges and violent or physical aggression. It puts people at risk of hospitalization, incarceration, or potential loss for services. Our team currently consists of 4 staff. There are 3 staff with caseloads of 20, 20, and 10 respectively, and then 1 staff is dedicated to training for providers and family members. Adding these positions will serve the immediate needs and also additional referrals, future needs, and respond to the increased training needs for the provider network and families. And then the 4 competitive employment positions, being successfully employed helps people, all people, realize their highest level of independence. Those at JCDS Competitive Employment Program work an average of 22 hours per week and earn an average of $10.15 per hour. These 4.0 FTE would reduce existing caseload sizes, meet anticipated referrals, and prepare for future growth. We actually had to pause referrals last fall for 2.5 months because we were at capacity for this program. One of the reasons the demand for this program continues to grow is this is an option for people who are on that 10-year Kansas waiting list for services. They can access these employment services while they're on the waiting list. And actually right now we have 36 of the 138 people receiving employment services who are on that Kansas waiting list for services. So this provides them that immediate service option. Again, this is another one of those services where there's not much other capacity in the local network, and other agencies providing these employment services have reduced those services. So in terms of the funding plan that the JCDS Governing Board discussed, we held a strategic planning retreat last fall. Part of that discussion included ideas on how we draw down the current fund balance, which is right at 30%, primarily due to COVID relief funds. Our target fund balance is 8 to 12%. We do understand, and this was part of the conversation, that requesting the use of reserve funds for ongoing expenses is an unusual request. In January, the governing board authorized a plan for us to present to you all to meet these immediate system needs with a way to, to draw down that reserve balance and initially fund these positions through a 5-year plan. Part of this consideration, and probably a significant part of the consideration, is JCDS does not have many capital or one-time expenditures. Over 80% of our budget is personnel and is heavily, as you know, driven by providing direct services to people. So ideally, these positions would be ongoing. As the system needs, we don't see decreasing. So for 2022, the request includes $700,000 of budget authority for the positions from reserves. Would work with the budget office annually for the appropriate reserve amount to be allocated. And also, just an important note, these positions do generate revenue. We expect at the current reimbursement rates that to be about $180,000 annually of revenue. So through the 5-year plan, we still would expect our reserves to be at or above that 8 to 12% target with these positions. And of course, JCDS staff and the governing board will continue to monitor the financial situation. If there's a need to reduce expenses or positions at some point, we would work with the county manager's office and budget office to make those adjustments. And I'd be glad to answer any questions you may have.
Mr. Von Ahnen, thank you for that full explanation. Are there questions? Any questions? Ms. O'Hara?
Yes, just for public consumption, I just wanted people to know the number on your reserves. It's $8,628,452. Is that correct?
All right, other questions? Mr. Ashcraft?
Thank you, Mr. Chairman. Mr. Von Ahnen, could you elaborate a little more fully on the revenues potentially generated by these positions versus the expenditures?
Yes, so each of these positions, each of these positions would have, each of these functions, I should say, has a different funding source. So for case management positions, for example, there's a rate that's paid in 15-minute increments. For the behavioral health team, we bill through the Johnson County Mental Health Center. Though that's under the mental health code, so there's revenue generated there. And then on employment, those services are billed through Kansas Vocational Rehabilitation Services. So there are different rate structures for each service. And I want to stress that the $180,000 is at the current rate structure. So there has, on some of these services, there's been quite a bit of conversation with the state about making adjustments to better appropriately fund these positions. As I mentioned, these services have limited capacity in our network right now because of the way the funding is structured. So based on the current rates, that's where the revenue would be. We would anticipate, I do believe there's some progress being made towards adjusting those rate schedules. And also, I think, if I may quickly, just want to mention a part of this funding conversation also includes there was a 25% rate increase to the services we provide that are outside of these requests that will begin July 1st. Okay.
Well, before next week, if it would be, before next week, if it would be possible, I'm trying to get an understanding of what the net cost benefit is, revenues versus expenditures for these 7 positions. Because
Thank you. This will remain on action. Excuse me, Ms. O'Hara?
Yes, thank you. How many vacancies do we have?
For our direct support staff, right around 20.
Okay, so my question is, we authorize these new positions, but yet we can't staff. I mean, I am totally understanding as to the issues that you're facing because, as I've said before, my son and I have a manufacturing company, and it is very, very difficult to find employees. But I'm just wondering if we have 20 vacancies and now we're adding 7.5 are we going to be able to fill those vacancies?
Yes, and good question. And to be clear, these are different types of positions than those direct support positions. These are more specialized positions. When we look at the difficult to fill positions within JCDS, these positions do not fall into those categories. We will have demand to fill these
These
positions.
are higher paid
Correct.
positions.
And more specialized, yes.
Okay, and is there any state funding on this? Because I know when you gave us the overview, what was this, a month ago,
Yeah.
that there was a lot of funding coming in from the state that was going to help our budget.
Correct. So there was a 25% rate increase for our home and community-based services. These services aren't the home and community-based services, but that is the bulk of what we do. So we will see significant increase in our revenue and our budget from that.
And that's reimbursement of cost?
It's reimbursement, but not full reimbursement of the cost.
Right, but it was 25% of the, okay,
25% on top of what the current rates are.
Okay.
These services are billed through the state of Kansas, though, to be clear, on either Medicaid or vocational rehabilitation services.
okay. Thank you.
Thank you. Remain on action. Next item.
All right, thank you.
Item number 3, request for proposal, RFP number 2021-060. Consider authorizing a contract with Integrated Psychiatric Consultants, PA, for Certified Community Behavioral Health, CCBHC, primary care medical, and psychiatric services at a cost not to exceed $2 million annually for a one-year period with 4 additional one-year renewal options, and authorize the reclassification of FY 2022 mental health reserves in the amount of $300,000.
Mr. Fortney.
Thank you, Mr. Chairman. Tanner Fortney, Mental Health. So in April of 2021, the state of Kansas passed HB 2208, which allows for the provision of certified community behavioral health centers within the state of Kansas. What CCBHCs are is they are, in a sense, sort of the behavioral health equivalent of what we call an FQHC, a federally qualified health center. And what they're specifically designed to do is to address the suicide crisis, overdose deaths, barriers to timely access to addiction and mental health treatment, delayed care, inadequate care for veterans, and the overburdened jail and emergency departments that we see prevalent throughout the state of Kansas. So with that in mind, there's an approval process that you have to go through to receive certification for this. The Johnson County Mental Health Center is very much in favor of pursuing this. And in order to go through that certification, there's a list of 8 services that are required to be provided. And I listed those in the first page of the briefing sheet. The ones that I've listed in blue, which have to do with screening and assessment diagnosis, patient-centered treatment planning, outpatient mental health and substance use disorders, and crisis services, those are services that are required to be provided by the CCBHC, so those would have to be provided by Johnson County Mental Health Center through our staff. The remaining services that you see on that list in green, those have to be provided, but they can be provided through what's called a designated collaborating organization, or a DCO, which means those services can be contracted out to a vendor or a provider to partner with. Now, of all those services that are listed, the Johnson County Mental Health Center currently provides every one of those services with the exception of item number 8, which is primary health screening and monitoring. So what mental health began in the fall of 2021 is we submitted an RFP that went out in order to solicit bids and look for vendors that would be able to collaborate with us and provide that primary health care component that we lack. After going through that process, we had 3 vendors that we ultimately interviewed for the process, and the one that was selected was Integrated Psychiatric Consultants. Now, in addition to the primary care component, mental health has also used IPC, Integrated Psychiatric Consultants, since 2018 to also provide supplemental psychiatric services because of the staffing shortages that we have and the fact that the client demand exceeds our ability to hire medical doctors and APRNs for that service. So that contract is also expiring this year, so when we did the RFP, we put both of those services out for bid, and we also allowed the vendors to bid on each one of those individually, so we didn't just limit it to a vendor that could provide both. But the RFP committee reviewed this, conducted interviews, and it was clear that IPC was head and shoulders above the other 2 providers, both in terms of costs, but also in terms of their ability to provide the services that we need. In terms of the funding for this particular project, so the way CCBHC works is Right, unlike what we receive now through most of our services where Medicaid pays a standard rate, and then we have our own costs and we bill Medicaid, but they pay what they pay. If it costs us more as a provider to provide those services, then that services we have to make up through county tax dollars or through balance of payments and being able to bill the client's fee for service as part of that. What the CCBHC rate does is it puts in place what's called a prospective payment system rate, or a PPS rate. What that means is that we submitted a costing analysis to the state for Johnson County Mental Health that identifies exactly what it costs us to provide 1 hour of psychiatric services, 1 hour of therapy services, case management services, so on and so forth. And by doing that, those rates will be the rates that we will actually be reimbursed from Medicaid once we're certified. So that will allow us for the first time to receive full cost recovery for the services we provide for those Medicaid clients. And we're projecting about $5 to $7 million of additional revenue that we would receive once we become a CCBHC. So that would be a huge amount of money that could be used to provide additional services to clients and offset a lot of the losses that we currently incur through our standard Medicaid billing. So with this request, we are asking for both the psychiatric services as well as the primary care services, where it's a 5-year contract, but it's actually a 1-year contract with 4 renewals, but it's a total of 5 years that we could enter into this agreement for, but we will review it every year. And for the first year, we're anticipating about $550,000. That would be July 1st of this year to June 30th of next year, and about $300,000 would be the estimated cost for the remainder of 2022. But over the life of the contract, we're only going to start with providing primary care services at our Olathe and Shawnee offices, most likely 1 day per week. But as the program grows and as the demand increases with our clients, we're anticipating that increasing quite substantially. And so as we've looked at it through the 5-year life of the contract, we're estimating it could be as much as $2 million that we would be contracting with this vendor for. Again, all of that revenue will be coming in through the PPS rates that we'll receive, so there's no county tax dollars. The last point I would make on the PPS rate is we've done that costing study this year, but every 2 years we submit a new costing study with a new rate. So a lot of the other cost increases that we've incurred during that time will be adjusted into a rate. So it's not something where we're stuck at a rate today, it's never going to increase, and 5 years from now we'll have to find more county tax dollars or grant funds or some other revenue stream in order to pay for it. So we are asking for the $2 million for the contract period over the 5 years, and then we are asking for a reclassification of reserve authority in the amount of $300,000 to be able to pay for FY 2022 services. So with that, I'll be happy to answer any questions.
Well, I think this is an excellent opportunity and should move forward. Questions? Ms. Fast?
Yeah, so these are MDs and psychiatrists, so I mean, anybody referred to them will have a diagnosis already, or do you refer clients to them that may not have a diagnosis? You know, I mean, so some will go there for psychiatric meds and other will just go there for medical well care. I'm not quite clear on this going forward.
So the way it would work is, so our clients that we see that come into mental health, a client could come in for the first time just like they do today. They go through a screening and assessment process. We evaluate what services they need, therapy, case management, medication, so on and so forth. We assign them with the services. Now, in addition to that, though, what this service will allow us to do is those same clients that come in for those services, we will have an on-site clinic to be able to provide the primary care screenings. So if those individuals, we would screen them, we would evaluate them just like when you go to your standard doctor's office, we might take your blood pressure. If you have high blood pressure or hypertension, then we'll be able to have you go through the primary care clinic and we would treat that. We might provide you medication. If you have diabetes, if you have other minor ailments that would be of a primary care nature, we're trying to find a way to provide holistic care to our clients. That's the idea behind it. So they'd have that access and not have to go to another service.
So that could be an initial diagnosis that you would refer, or I guess.
It could be an initial diagnosis, or it could just be that we might have a client that we've served for many years, and just as they've gotten older, they've developed other health problems, like blood pressure, diabetes, and now we know about that, and we catch it. they would be able to get those primary care services.
So you already have a medication clinic. Does this group do that? These psychiatrists already do your medication refills and so forth? Are they in supplement to your nurse practitioners that do assistance with medication?
So the medication that we provide right now is usually psychotropic medications that are related to actual mental health diagnoses. They're not necessarily medications that would be related to things such as hypertension or diabetes. Our on-site pharmacy does fill prescriptions, and they can fill those type, but those scripts don't come from our doctors. Those would come from outside providers.
So this program would allow someone who does not have a primary care physician to have access there too.
That's absolutely correct, yes.
Okay, good, thank you. Ms. O'Hara?
Thank you. So on issues like diabetes and high blood pressure, we're emphasizing exercise and diet. I mean, that is part of the system and the recommendations to these people, and not just taking a pill.
Yeah, it would just be just like a primary care clinic. If you go to your primary care physician, usually one of the first
Right.
things they're going to talk to you about is the importance of
Of
taking care
exercise.
of your health and doing that first before we would ever get to the point of medication. But if an individual is
Right.
at that point,
Right.
the service is available.
Okay, and then I believe that your reserves are approximately 6.5 million.
Yes, our reserves, I was anticipating that after the last presentation, and I had my finance manager give me the exact number. It is 6.49 million.
That's pretty close to 6.5.
Yep, that was
Okay.
what I gave you. I
Okay.
was giving you the exact amount.
Okay, thank you.
Vice Kraft?
Thank you, Mr. Chairman. Mr. Chairman, to your comment, the last few years, the literature has really been pushing for this integrated approach, and conceptually, it makes a lot of sense. And even though you looked at the two potential services independently, I would agree that having the same provider would potentially have a lot more relative merit. So I'm very supportive of that. And I think this item's in good order, Mr. Chairman, so if you'd like to put it on consent, I would have no objection.
That's fine. One other quick question. As I understand it, this is part of a expanded or new state effort, is that right?
That is correct. It was approved last year, the CCBHC bill was, and so mental health centers this year are now applying.
No, I think that should be noted, and congratulate the state for taking these steps. So this will.
The state of Kansas?
Yes.
Congratulate the state, okay.
Yeah.
You must be in a good mood.
Yeah, I agree with the consent, but I do want to highlight that when you're on psychiatric medications, it is often very hard to control your diabetes, your high blood pressure, and so the interactions between medicines when you have a severe and persistent mental illness with psychosis. The extreme difficulty then if you have any other medical condition. And so this isn't someone who's just coming off, the street that needs help, starting an exercise program. It's very difficult when you're dealing with some of these psychiatric medications.
Right. Okay, this will go to consent. Ms. Hanslick?
I just wanted to add my support for this action also, and fine with it going on consent.
Content.
Of course. In my early social work career, I worked at a community mental health center in the emergency department, and if we had had the opportunity to have someone have both of these services on site at the same place would have been tremendous. So I'm very excited about it. Thank you.
All right, so noted. Consent. Next item.
Item number 4, IFB number 2022-037. Consider authorizing a contract with Goddard & Son Roofing for the office roof replacement and warehouse sealant repairs at the election office facility for a total amount not to exceed $233,899 per invitation for bid, IFB number 2022-037.
Mr. Waters.
Good morning, Commissioners and Chairman. Joe Waters, Assistant County Manager, Interim Facilities Director. This is a replacement of a portion of the roof at the election office and then a sealing and repair of the other portion, the larger portion of the building. The flat roof portion is that's to be replaced. It is about, well, it was put in 1998, so 24 years old, which is a long time for this particular type of roof. Time for it to be replaced. The metal roof, that is the larger ceiling space where the machines and the other equipment resides, is an older roof still. It goes back to 1983, but the seal process will buy 10, 15 years or more. The last time this was done was 15 years ago, so the first time it was done was at 15 years. Now this is 24 years later, sealing this roof. So it's been, we've extended the life as long as possible. We've got some very good bids here. The consultant's estimate was about $234,000, and our lowest bid to Goddard and Son Roofing was a very competitive, just about that number. Four good bids. Staff and our consultant recommend award, and I'd stand for any other questions.
Questions?
Consent.
All right, this will go on consent. Thank you very much. Next item.
Item number 5, IFB number 2022-043. Consider authorizing a contract or contracts with Free State Logistics, LCC, for the purchase of shelf-stable food program for older adults in the amount not to exceed $500,000.
Ms. Leahy?
Good morning, Megan Leahy with Aging and Human Services. This item is a contract that we're bringing to you that we've worked with county purchasing on. The purpose of this is to do a distribution to clients in our aging program where they'll receive shelf-stable food items and some other supplies. What this looks like is we work with a vendor and they acquire all the supplies, pack them, and then deliver them individually to each of our clients at their homes. Within the delivery, about half the items are shelf-stable food items, kind of a variety of canned fruits and vegetables, chili, soup, peanut butter jelly, and then the other half being toiletries and cleaning supplies that are just really basic household staples. We've done this a few times in recent years, and we've received extremely positive feedback from our clients about this. We anticipate doing 3 deliveries. One would be in June and then 2 later this year. The number of clients that would get this would be, we have about 800 interested in the first one and probably similar or a few less in the next 2 deliveries. The funding source for this is the $1.6 million ARPA grant that you approved about a month ago. And within that grant, there is a $200,000 local match required by the county. And the state has worked with us and said that if we could spend that by June 30th, which is the end of the state fiscal year, they've identified funding to cover our local match, which would mean that from that $1.6 million ARPA grant, there would be no local match for all of that, which is really good news. It was just a really short time frame, so our staff and purchasing have worked really quickly to put this program together. So I really do want to thank purchasing and our staff for their work on that. So we recently did an invitation for bid to find a vendor for this. We received 3 responses. We are recommending awarding the contract to Free State Logistics. They did have the lowest bid of $215.47 per delivery. You can see the bid amounts on the briefing sheet and that Free State was the lowest by a little over $4. We're asking for a 1-year contract in an amount not to exceed $500,000 with the option for 4 one-year renewals. Staff recommends approval, and we really believe this is a great use of one-time grant funds, and that this really fulfills one of the purposes of the ARPA grants, which is to assist older adults with food and nutrition needs. So we've had some preliminary discussions with the vendor who's ready to get started as soon as this approved in order to meet that June 30th deadline with the state. Available for any questions.
Any questions? Mr. Ashcraft?
Thank you, Mr. Chairman. Mr. Chairman, I'm supportive of this, and if consent's the wish, I'm supportive. But I do have some programmatic questions, so maybe before next week, if we could visit, I would appreciate it.
Sure.
Other questions, Ms. O'Hara?
Yes, I sent this to Pam Shernock, who is the chairperson for the Council on Aging, and to just get her feedback on it. And she was a little surprised that this was not even mentioned at the Council on Aging meeting. I believe that the meeting was yesterday, or anyway, she was surprised that it was not mentioned. And she just wanted to emphasize that right now, we make a 5 to 7 day shelf-stable food delivery to all homebound clients before snowy weather arrives, and that's usually in November. So is this in addition to our current program that's in place?
Right. So usually each fall, we will deliver up to 5 shelf-stable meals for the home-delivered meals clients. So then on the days that we have to cancel
Right.
because of weather, we encourage them to use one of those. So it is separate from that.
So this is in addition to, so basically, our clients are going to have more staples in reserves. Is that the idea behind it?
Yeah, we don't have any expectation that they hold this for weather like we would with the blizzard boxes.
Okay, but we're not diminishing the home delivery meals at all?
No.
Okay, I just wanted to make sure. Thank you.
Ms. Hanslick?
Thank you. And following up on that discussion, my understanding is this program that we're discussing in this item is not just limited to people who receive home-delivered meals, that other people can participate, or am I incorrect on that?
You're correct. We have offered this for, home-delivered meals are a large number of our clients. We also have in-home services, so some of them are not meal recipients. And this one we have also offered to our CHAMPS participants and our congregate meal. Sometimes we have to limit that based on funding, but for this first delivery in June, we've opened that for all programs.
No, I appreciate that. The clarification, this is not part of the home-delivered meal program per se, but it's for a wider range of residents.
Yes.
Thank you.
Well, unless there's objection, this will go to consent. Ms. Fast?
So can you say a little bit more? Is it a grocery bag of items, or how is this packaged, or a box? And, you know, is it all canned, or is there like some cheese, fresh things, or what's in this?
It's all shelf-stable, so there's nothing refrigerated.
Okay.
So about half the items are food, so they'll use probably a box or a couple boxes for the canned items and the food items. And then we will actually provide some grocery tote bags, you know, like what you would use if you went to Aldi or something. So they could use those to separate the cleaning supplies and the toiletries, just so they don't mix. And then we can put our, phone number and our information on those bags for clients.
And it'll all go out in one day, or more than one day?
I don't think they could do them all in one day, but we try to do it within a week or maybe a little longer, to 800 clients. So yeah, it takes a little bit of time.
Okay, all right, thank you. This will remain on consent. Next item.
Item number 6, resolution number 031-22. Consider adopting resolution number 031-22, exempting a certain portion of an outside area of county-owned property from the provisions of KSA 41-719D to allow the sale, possession, and consumption of alcoholic liquor and cereal malt beverages.
Mr. Waters.
Joe Waters, Assistant County Manager. Commissioners and Chairman, this is a follow-up item actually to the conversation we had last week in the Committee of the Whole about the future developments that are being proposed for the county square. I mentioned then that we would be bringing some items forward pretty quickly that are related to the square, some related to the development of it, but also just the operations. This is the first of those items. We have been working now for several months with the city on this concept. The city has established a downtown Olathe common consumption area. And they took that action about a month or so ago. And so they have identified and outlined an area here in the downtown for the common consumption of alcohol or cereal malt beverage for special events. And those special events would be authorized by the city, and there's hours and that sort of specific hours, that sort of thing. The properties that surround the administration building, and you can see on the associated map, are included in that overall area. So this action would put us in alignment with the actions that the city has taken to create this larger district. I also mentioned last week, as I said, that there will be some other agreements, other pieces to this too. The next thing that you will see from us, and we are waiting the meeting that we have similar to the committee of the whole we had with you all last week. We have one with the city next week. And so when both of those things have happened, we will finalize the management and maintenance agreement between the city and the county, and then bring those things back for formal action for both bodies. In that agreement, it will be clear that the city is really going to be in the role of managing and planning these special events. They will issue those permits. They will manage the various regulations around it, the events, including any requirements from those vendors that they have proper licensure and that sort of thing. And they will enforce as well on the city streets in that whole district, as well as on the county property. So again, this will line us up with the city's DACA ordinance. And with that, I would stand for any questions.
Well, the only question I have, it needs to be specific that the city has a responsibility for the event on our property, and the liability exists with them and not the county.
Yes, sir. Those details are being worked out now in that agreement that will come.
Okay, Ms. O'Hara.
Have we had the sheriff's input on this?
Yes, the sheriff's department is comfortable with this approach and concept, subject to the review of the agreement as it comes.
Are there other cities in Johnson County that allow alcoholic beverages to be carried around in events?
I am seeing some nods along the dais. I've been told that Shawnee has a similar situation.
Several
in other
cities.
areas. Yep.
And it hasn't created any problems?
Not that I'm aware of.
Okay, thank you.
All right, consent?
Yep.
All right, so noted.
Thank you.
Are there any other items?
No, sir.
All right, that concludes our agenda review. We are at about 12:12, so we've got an opportunity to eat lunch at Feed the Need. And let's begin our county manager presentation at 1:15.
So
That'll give everybody an hour.
It's
So,
here, right?
Thank you all very much.
Yes.
Right here in this,
Thank you, Mr.
yes.